Welcome to Mind Matters. Today we're discussing mental health in LGBTQ communities, a critical topic with unique challenges. Mental health struggles impact everyone, but for LGBTQ individuals, these challenges can be amplified. Did you know LGBTQ people experience mental health conditions at higher rates than the general population? According to studies, LGBTQ youth are more than twice as likely to experience depression and anxiety. Data shows that over 40% of LGBTQ adults report having a mental health issue. The reasons behind these statistics are complex, often linked to societal stigma, discrimination, and identity struggles. One of the most common challenges faced by LGBTQ individuals is depression. Depression rates among LGBTQ youth are significantly higher than those of their non-LGBTQ peers. Research reveals that around 60% of LGBTQ youth experience persistent feelings of sadness or hopelessness. These feelings often stem from a lack of acceptance, social isolation, or family rejection. Depression can manifest as low energy, loss of interest, and feelings of worthlessness. When left untreated, depression can deeply affect daily functioning and overall quality of life. In the LGBTQ community, another prevalent issue is anxiety. Anxiety rates are higher in LGBTQ populations, often due to fear of discrimination. For many, simply being themselves can lead to judgment, adding to stress and anxiety. Social anxiety is particularly common as individuals fear rejection in public or social settings. This can lead to isolation, a lack of support systems, and even worsening mental health. High levels of minority stress also contribute to anxiety and other mental health conditions. Minority stress refers to chronic stress faced by marginalized groups, impacting physical and mental health. Studies show that prolonged minority stress increases the risk of mental health issues in LGBTQ individuals. Another challenge is internalized homophobia or transphobia, negative beliefs directed inward. This internalization can lead to self-hatred, low self-esteem, and harmful behaviors. For some LGBTQ individuals, accepting themselves can be a painful journey. Unfortunately, society doesn't always provide safe spaces for them to do this openly. Rejection from family or friends can also worsen mental health conditions in LGBTQ youth. Research shows that LGBTQ individuals who face family rejection are 8 times more likely to attempt suicide. Acceptance from family members, however, is linked to better mental health outcomes. Supportive family environments can reduce depression, anxiety, and suicide risks. But what about access to mental health care? LGBTQ individuals often face barriers when seeking mental health treatment. One major barrier is a lack of culturally competent providers. Culturally competent providers are trained to understand LGBTQ specific challenges and experiences. However, many LGBTQ people feel misunderstood or judged by mental health professionals. This lack of trust can prevent people from seeking the help they need. Financial barriers also affect access to mental health care in LGBTQ communities. Some may lack insurance coverage, while others face discrimination in health settings. Costly treatments without insurance can make consistent care unattainable. Unfortunately, LGBTQ individuals also experience higher rates of substance abuse. Substance abuse often arises as a coping mechanism for underlying mental health issues. Studies show that LGBTQ people are twice as likely to have a substance use disorder. While substances can temporarily ease emotional pain, they often lead to more problems long term. For many, the journey to mental wellness includes overcoming both addiction and mental health struggles. Despite these challenges, there is hope and resources are available. Therapy is a powerful tool for LGBTQ individuals facing mental health challenges. Therapies like cognitive behavioral therapy, CBT, are effective for treating anxiety and depression. Support groups can also provide a sense of community, reducing feelings of isolation. LGBTQ affirmative therapy focuses on creating a safe, understanding environment. In LGBTQ affirmative therapy, clients can discuss their identities without fear of judgment. Building a positive self-image is often a focus of this kind of therapy. Support groups specific to LGBTQ youth have proven to improve mental health outcomes. These groups offer shared experiences and validation that foster resilience. Advocacy for LGBTQ mental health is on the rise, with organizations offering resources. Groups like the Trevor Project provide crisis intervention and suicide prevention services. Online resources also help, with virtual support groups and helplines available. A crucial factor in improving mental health is creating a supportive environment. Friends, families, and allies play a vital role in supporting LGBTQ individuals. An accepting social circle can help LGBTQ individuals feel safer and more valued. Allies can offer support simply by listening and validating experiences. Schools and workplaces that embrace inclusivity also enhance mental well-being. LGBTQ clubs, ally networks, and safe spaces are effective tools in these settings. Legislation that protects LGBTQ rights is also important for mental health. When LGBTQ rights are defended, mental health outcomes improve for the entire community. Globally, more nations are recognizing and addressing LGBTQ mental health needs. Countries with supportive laws often see lower mental health risks in LGBTQ populations. Education and awareness in schools can also foster acceptance from a young age. Health professionals are encouraged to learn more about the unique challenges LGBTQ people face. Some universities now offer specialized training in LGBTQ mental health care. With improved training, more professionals can deliver compassionate, effective care. A future where LGBTQ individuals receive equal mental health support is achievable. Thank you for joining us on Mind Matters. Let's work together to support the mental health of all communities. Please like, subscribe, and share this video to spread awareness about LGBTQ mental health. Together, we can build a more inclusive, understanding world.